On SABC News, we're broadcasting live from our Auckland Park studios in Johannesburg, South Africa. Now we're going to take a look at your continental stories. And hospital morgues are not coping with the number of dead people in Liberia. And to make matters worse, locals are chasing burial teams away for fear of contracting the dreaded illness.
Do not want the bodies buried in their neighborhood. In many cultures in West Africa, families wash the bodies of their loved ones before burial. But this practice is dangerous for Ebola victims because of the presence of bodily fluids which are highly contagious. According to specialists, the moment a person dies from Ebola is the moment when the person is the most infectious and when the viral load is at its highest.
Ebola is here. We need to be very careful. Yeah, we should not be in a state of denial.
According to World Health Organization figures, Ebola has been blamed for 672 deaths in Liberia, neighboring Guinea and Sierra Leone. Liberia has closed schools and considered quarantining some communities, according to the President Ellen Joseph Sirleaf, who has announced the tough measures to halt the worst Ebola outbreak on record. But officials are not only battling the deadly virus, but also the community's mistrust.
We heard that there was some problem along the line or at other communities. So we need to give them the covered protection so the body can be buried.
But in another turn, after tough negotiations with the local communities, the bodies were still waiting in trucks for burial as the diggers sent to dig the graves got stuck in the mud, unable to work. Ebola is a hemorrhagic virus with a death rate of up to 90% of those who become infected. The fatality rate in the current epidemic is about 60%.
It's quite clear that the fear of Ebola is growing, and international leaders as well as health organizations are struggling to try to stop the deadly epidemic in West Africa. The World Health Organization says this outbreak is moving faster than the efforts to control it. However, the National Institute for Communicable Diseases says there are no cases of the deadly disease in South Africa at the moment. Ebola outbreaks have previously occurred on the continent, and they have always been brought under control each time. But how prepared are we should a case be confirmed on our shores? That's the question we're asking today. And to find out, we're of course joined in studio by the Deputy Director of the NICD, Professor Lucille Bloomberg. Professor, thank you so much for joining us this morning. I suppose the big question is, are we prepared? Should an outbreak occur in South Africa of Ebola?
I really think we need to step back. I think the risk of spreading the disease is regional in West Africa. 3 countries affected, 1 case imported case in Nigeria. And I think the risks in the region are the issue. I think the risks of outbreaks in other parts of Africa or in other countries are really, really very small.
Yeah. And I mean, you were also quoted on Friday as saying that South Africa will not allow foreign nationals with a deadly virus into the country to receive treatment. Is this true?
I think I need to clarify.
Yeah.
You know, in health facilities in South Africa, they are open to everybody. Anybody who comes to our health facilities are treated. If there is a confirmed Ebola or suspected Ebola in a South African national or South African resident working in West Africa, of course they need to come back to the country for care, provided they can be transported safely in a medical evacuation flight. If there is a foreign person, a foreign national, who becomes ill in West Africa and the diagnosis is made there will have to be some negotiations to discuss any possible treatment in South Africa. But for the most part, countries with foreign nationals who are working there have made their own arrangements. And you saw the American physician and the nurse have been transported back to the United States for treatment. And a few other countries have made similar arrangements should their own nationals become ill.
And what are the chances that this outbreak comes to South Africa? Should we only expect it if perhaps a South African who's currently in West Africa comes back with the virus? What are the chances of that virus?
So I think we need to just look at how it's spread. We have a number of people who are working in the country, in mining industry in particular. We need to understand that it is only contracted if there is direct, close contact with organs, body fluids and tissues of infected or dead patients. And miners who are working there or other industries are not going to have that contact. So their risks of Ebola would be almost zero.
And Professor, suppose people at home are wondering, why is this particular virus more severe or most severe as compared to previous viruses and previous diseases that we've heard of in Africa?
Well, I think Ebola has always had a disease with high mortality. First of all, there's no specific treatment, so you can't stop the infection. There is only supportive care, and I think in those areas it's very limited. I think health facilities are very under-resourced. And it is a virus that attacks multiple organs, and there's no stopping it once a person gets infected.
And are there any misconceptions about this disease that perhaps have been imposed in the media?
I think it's how it's transmitted. I think people don't understand that it's not casual contact. And then I think on the ground there's many misperceptions, as you saw in those audiovisuals that were seen, particularly with cultural beliefs and burial practices.
Yeah. And I mean, speaking of burial practices, we saw a clip of frustrated family members of the victims of Ebola, and it's quite sad to find that people cannot bury their dead because, as the insert said, that the virus is most active when the person is dead.
Well, no, it's most active when they're alive, but it can survive in body fluids in those an hour, hours or even a few days after they have died. And, you're dealing with cultural practices that go back a long time, and now, at a very emotive time, you're trying to change that. But it's critically important. This is a major mode of transmission and is amplifying the outbreak.
I think another frustrating element of the Ebola virus as well is that, burial teams have also been sent back. There are fears that even medical practitioners who are there to assist might also be infected with the disease. How frustrating is that situation?
I think it's a very dangerous situation. I think the medical staff on the ground are themselves very fearful. They don't have enough protection to protect themselves. A number have died, up to 60. And then you have the community rising up against them because they don't trust them, or they see that they have a part in causing the death of their loved ones. Yeah.
And funds now have been pledged in West Africa to fight the outbreak. In your opinion, is this too little or too late?
Well, a little bit of both of those, but it's not just funds, it's human resources, and it's changing those cultural practices to try and contain the outbreak. The outbreak's going underground, so people are hiding bodies. They don't want them to be taken away for burial by some strangers. They don't want to go into these isolation facilities. 40% don't come out, but in fact a bit more than that. But some do, and it's that early supportive treatment that may make a difference.
Yes, and we do know that other countries have pledged, of course, to assist where they can in terms of aid and funding, as we have now learned. What is South Africa currently doing to play a part in this African problem?
Well, it looks like our laboratory at the National Institute for Communicable Diseases, we have the only highest security laboratory on the continent, may be assisting in the outbreak in the next few weeks. And we've had a few staff on the ground who've helped with contact tracing.
All right, thank you so much. Professor Lucille Bloomberg, the Deputy Director of the NICD, thank you so much for joining us.